Everyone. I would like to start with Surah Ikhlas. Bismillah ar-Rahman ar-Rahim. Kul huwallahu ahad, Allahu samad, lam yalid, walam yulad, walam yakul lahu kufuwan ahad. Today's topic is unvaccinated people dying from COVID-19, and our message is please get vaccinated. So there are a couple of slides I'll quickly go over so you guys know what's going on right now. So this is an update from UT Southwestern as of July 28th.
I don't see the thing. I don't see the updated thing, Sanober.
You don't see the slide?
This is a question and answer slide here.
Oh, really? Oh, hold on.
Yeah.
Let me see. You should give the whole PowerPoint slide. Do you see that now? Do you see the slide now? You're muted.
All right. Now, yes. Can you hear me?
Yes. So you
Yeah,
see
yeah. It looks good.
Okay, perfect. So this is the slide from UT Southwestern. This is data from July 28th as of July 26th. So the black curve here is the cases that you saw October 2020, then you saw 2021 January, then April, and then you saw April to July, we were pretty good. And then now this blue line is predicted cases. The black is where the curve is actually going. So currently the hospitalizations have increased by about 97% over the past 2 weeks. And so if we continue to do what we're doing, which is at this point, a lot of people are not putting a mask on, they're not following social distancing guidelines and stuff, then we are headed to a trajectory much worse than we dealt with before. Now, if we start doing masks and social distancing, full mask, don't go out, and so at least for next 2 to 3 weeks, then they had another slide with a graph that it will plateau out if we follow the guidelines. But this is if we did what we're currently doing, then we are headed for a problem. This is another slide from UT Southwestern that's going over Collin County on the top left, Dallas County on the top right, Tarrant County, and the Denton County on the bottom. So you look at the age group, the blue one is age group 65 plus, the green is 50 to 64, the yellow is 18 to 49, and then the pink is a pediatric population. So in each age group, we have a huge spike going on. And this is like a 7-day admission average here and daily average that's what we're looking at. The fastest growth we're seeing is the age between 18 to 49. And then also, recently you've seen increase in age over 65, which is where, most of the deaths and the illness is gonna happen in 65 plus. However, we're seeing that in 18 to 49, younger people, even as young as 19-year-old getting intubated and getting on a ventilator. So it's a time that the Delta variant is what is our concern at this point. Can you guys see the slides or no?
No, we cannot see. Only one slide I'm seeing is Tarrant County future forecast.
Oh, I think there's something with the sharing. That's what's going on. Let's see.
I can see all slides.
Now I see. Now. That's better.
Okay. What about now? Do you see?
No. Yes. Yes.
Okay, perfect. All right. So this is the slide that I was going over, the Collin County, Dallas, Denton, and Tarrant County, how the spike is going on in all age groups at this point. In Oklahoma, I don't know if you guys heard, there's a spike in children hospitalization as well. That is both RSV and COVID related, but a lot higher number recent in the past week, COVID related hospitalizations, to the point they don't have NICU beds in an OU. So now this is what percent positive COVID-19 tests, and you can see again, starting from March 2020, then you can see July 2020, we have a spike. Then we have a spike in December to January 2020, and now we're headed to another spike right here. And the hospital volume just over the past 2 weeks has increased 38%. And then if you compare that to 2 weeks ago, that's 101% increase. If you compare that to 1 month ago, that's 30% increase as compared to a month ago. This is another slide to tell you like how important it is to hunker down really a month right after any holiday has happened. So the A here is Memorial Day. B is where the mask order was put in, and you can see how it goes down, the number of cases go down. You can see is the colleges and schools reopen here, and then you see the spikes just slowly go up. And then you see Halloween, also same thing, spikes go up, and then you go down. Then every holiday that we have had increase in the spikes. And so right now we are dealing with the July 4th holiday is why we're dealing with all this right now. So I think the message would be that every holiday that we really, really need to make sure that we are hunkering down afterwards and during that holiday. Now, next thing is looking at the Cleveland Clinic. Again, this study showed the same thing. The 99.75% of the hospitalized COVID patients were not vaccinated. Now, we don't, at this point, this rate has dropped down to about 90% are not vaccinated. We are seeing about 10% vaccinated individuals getting in. So 1 in 10 that have been vaccinated seem to be getting admitted. And that's usually mainly because of the Delta variant at this point. Then this is one of the things that 2 out of 3 deaths that have happened are from COVID-19. This is again, data from January to early October 2020. Now, a lot of these were Hispanics, Latino, and adults aged between 25 to 44.
I don't see the slide.
Okay, let's see. Give me 1 second. So I'm not sure what's going on. Is everybody not able to see it?
Now I see it now.
Okay. Now, do you see this one? The vaccine doses that have been given, and we have talked about that before, that there were 2.4 billion vaccines so far that have been given. And that I'll come back to later why it's so important. Now, looking at the Delta variant, so this here, the green is the Alpha variant. Then you got the Gamma variant, Delta, Iota, and the other. So currently, as we go from May 22nd to July 3rd, Delta variant has become the dominant variant in US. And that's a lot of this is, travel related that we have had from, outside the US. And that's now at this point, a lot of cases of Delta variant. Now, CDC data is somewhat behind as well. The reason is because some of the testing for Delta variant is backlogged significantly. So the assumptions are that 85% is Delta variant. However, current numbers, statistics wise, about 50% are Delta variant. Now, looking at the types of the COVID-19 vaccines, you have 2 kinds right now that we're looking at. One is mRNA vaccines that are, that's and I'll go over that later on too. That's the material from COVID-19 virus. That's a dead virus, the membrane that we take and then, put it in the lipid formulation and put it in the body that gives instructions to our cells to make antibody against the harmless protein that's unique to the virus called the spike protein. The other vaccines we have is the vector vaccines that are J&J, AstraZeneca, and Sputnik. That's the weakened adenovirus. That's a different virus than the COVID virus. So it's a weakened virus. You basically get the genetic material from COVID-19, you put in that virus, and that's the one we are giving, and that's J&J vaccine basically as a vector. So it presents to our cells, and our cells basically make the antibodies against that virus. So when we actually see the live virus, COVID virus, we have antibodies that can fight it. This is one of the depictions that, we get the mRNA from the COVID, we put it in the lipid formulation, inject it into the human intramuscular, and then that basically tells our cells, hey, there is some spike protein that doesn't belong here. It's here, our cells will digest it and then present to our bone marrow. So we make antibodies against that protein. And then next time, if you actually see the live virus, we'll have antibodies that can neutralize that virus. Now, looking at the vaccine side effects, typically you're going to get soreness, redness, mild fever, muscle or joint aches, headaches, and tiredness. But, and then when you look at the actual infection, as you all know, pulmonary fibrosis, ventilator, COVID long hauler. So that's why, we try to tell patients your vaccine related side effects are on the bottom, and your virus related side effects, if you get that virus, are very much on the top. So, comparison wise is very important to get the vaccine. The Moderna and the Pfizer are 2 doses. J&J is a single dose. Moderna and the Pfizer are the mRNA viruses, while the J&J, as we talked about, is the adenovirus vector. Effectiveness wise, Moderna and Pfizer are both 94-95% effective after the second dose, and J&J is only 66% effective. Looking at the side effects, blood clots were reported with J&J, 16 people out of 8 million vaccinated. And then Pfizer had anaphylaxis. Moderna has not had significant side effects except if you have shellfish allergy. Pregnancy-wise, there's more data out. Actually, there's a recent study out just recently that is encouraging us to vaccinate more and more pregnant population, because that'll actually confer immunity to the child as well. The misinformation wise, I'll say there are so many misinformations that a few that I'll tackle right now. One, there are trackers inserted in the arm and they're monitoring us. The most important thing to know is it's a liquid, it's the lipid formulation. There's no trackers that can ever be inserted. We give it ourselves, and we have in the past, and you can be sure that there are no trackers that are being inserted. The other is, like, I'm young and healthy, I'm not at risk of dying. Currently that we have variants that are going on, this is not true anymore. This was true last year when we dealt with it. Now it's mutated. So we're seeing more and more younger population. In fact, the current spike in hospitalization are between the age of 18 and 49. And none of them have, a lot of them don't have any other comorbid conditions or any other problems that increase the risk. So young, healthy population is getting it. The other thing people say is no one knows the long-term side effects of the vaccine. And I keep saying, we know that at this point, how many people got COVID infection and what they're dealing with and how many side effects. As a pulmonologist, I'm seeing these people a year to 6 months into it with scarred lungs on oxygen. And even though they're out of the hospital and they didn't die from it, but they're still dealing with the long haulers. Now, you look at the vaccine, on the other hand, you have short-term side effects of, like I said, fever, soreness, and stuff like that. And it's about a year, over a year now, when you look at the research, when the first individual was recruited into the study was June of 2020, to now, we don't see any long haulers from the vaccine. We see a lot of long haulers from the infection. So get vaccinated is extremely important for you to do that. Now, the other thing is COVID vaccine will give me an infection. Just like previous slide, I kind of mentioned to y'all that the virus itself is dead, right? So we're just taking the genetic material, what tells us, and I have heard another thing that, oh, they're giving us DNA, it's gonna change our DNA, and that's exactly not true either. It's a dead viral RNA that we're getting, and then our body is just recognizing it, that this is something foreign to us and making antibodies against it. So you cannot get an infection from this vaccine. So that's very important to know that. You can get a fever, you may feel achy, but that's just common side effects from any vaccine that you may have gotten in the past. The other question that we have had is, one, I have gotten acne with a mask. What do I do? Should I not wear the mask? So, I would say, like, avoid makeup, maybe put cloth mask under your N95 and surgical mask, but put the mask on, because if you're alive later on, you can deal with that acne later on. Other is, do the vaccines affect fertility? So the plain and simple answer is no. There's nothing in it that's going to affect the sperm count, that's going to affect the woman fertility, that's going to affect anything. So please get vaccinated. Pregnancy-wise, I think I already talked to you guys about the CDC does encourage that pregnant women do get vaccinated. However, the data is still coming. The most recent data is showing safety. So it is still encouraged that they do get vaccinated. Other is it safe to hang out? currently, I don't think it's safe to hang out. If you saw that curve that I mentioned with UT Southwestern, next 2 to 3 weeks are crucial that we don't go grocery shopping if we don't have to. We don't go out to eat if we don't have to. So, and if you are gonna go meet with somebody, please be sure 100% that you know they're vaccinated, otherwise it's not safe. The other will be, do we need a booster? Like we had many questions on that. At this point, it does seem like it that we will, but nothing has been out. It's not been recommended at this point. However, I do think it's gonna, it's coming. One more I got before was if I got vaccinated outside US, for example, Pakistan or India or anywhere else, should I get vaccinated again? So the answer is yes, because we don't know the efficacy there. We don't know what they're getting. So it is recommended that they get vaccinated. Is it safe in kids? At this point, yes, kids over age 12 should get vaccinated. There were some cases of myocarditis and pericarditis, but that was 1,000 cases in 177 million people that are vaccinated. And if you know anything about the COVID, COVID disease itself is going to cause myocarditis and pericarditis, or can cause it. And you have more incidents with COVID disease itself than with the vaccine. So the risk is really, really, really low, and all of them recover really well. So it is still recommended that those kids get vaccinated. As I said, the data is alarming at this point in children as well, that we are seeing more and more cases and admissions. Now, the other question will be, do I still need precaution after vaccination? And the answer is yes. If you got Moderna or Pfizer, after the second shot is where your immunity is at 94 to 95%, and that it takes 2 weeks for your body to make antibodies against that vaccine. So after the first vaccine, the immunity is around 50% for Pfizer, 85% for Moderna. After the second shot is the immunity is about 94% for Moderna, 95% for Pfizer. But that's 2 weeks after the second shot. So you're not safe until after 2 weeks after that. So you can still get infected. If you got the vaccine, I've had patients where they got the vaccine and then they got tested and they were positive. The vaccine didn't make them positive. They unfortunately hung out with somebody that was infected right at the time they got vaccine, and they are positive after getting the vaccine. But vaccine in no way, shape, or form can make them positive. Hand washing, face mask, keeping 6 feet distance, still recommended. And that's really what I have for today. And I will welcome any questions.
Cannot hear you.
Yep. So I have a question here that says, what do we suggest for people going to masjid? Should they put a mask on and keep the 6 feet social distancing? Is it safe to get together and safe to go to masjid, since we do not know if people are vaccinated or not? So at this point, now that we're in the peak, I don't think it's safe to hang out. It is strongly recommended that if you are going to do that, that you're masked, that you are keeping 6 feet distance. I think masjid at this point needs to make that a priority, that we keep our ummah safe, and that we keep 6 feet distance, and that we mask up and encourage everybody to get vaccinated. That's the only safe way out of this pandemic. If we have any way out, that's only vaccines. So another question is it safe for kids to be in person for school this fall? So yeah, that is very alarming, the peak that we are seeing at this point. So I mean, personally, it's not safe. I'm not sure why school is dragging their feet, but yeah, it's not safe. Any other questions you guys have? Oh, so another question is tell the intensity of data, Delta variant. So intensity wise, look at it as like, you know, how fast chicken pox has spread it in the past. And that's exactly how fast it's spreading. So like even the 6 feet distance outdoors, when it came out, we thought it was safe. For Delta variant, that distance is not enough even. So even it's spreading even outdoors. So at this point, outdoors or indoors is not safe, given that majority of the COVID infections currently are all Delta variants. Another question I have is any side effects long-term if you got vaccinated in Pakistan with Chinese vaccine and come to US and get Pfizer, any suggestions? Not really, you know, we have not had, number one, we don't know data on that. However, there is no evidence that people that got vaccinated outside and got vaccinated here had any severe side effects from it. The only thing you have to be careful, you know, with Pfizer, since there is, if you have allergies and if you have had anaphylaxis before where you swelled up or you had rashes after any vaccine or antibiotic, then you have to be careful with Pfizer. You have to have an EpiPen and stuff. In that case, you know, usually I recommend if you have had anaphylaxis that the Moderna is probably safer. But otherwise, it's very safe. How many patients currently are admitted at the hospital age group wise? So currently the numbers for us are about 54 patients we have in about 300 bed hospital that are COVID positive and admitted due to COVID complications. And that's a fairly big number. That's about 15% of our patients. And same is true for, I know Parkland had about, I heard last was 35 patients. I don't know the current numbers that they have, but we know that hospitals are about to reach capacity for ICU, and that's exactly what we dealt with before. And that's only 2 weeks into the peak. I think one message I would want to give is, you know, a lot of the time we are getting invitations for stuff because we are getting we're comfortable, and we know from April to July or end of June, we had like a, you know, plateau. But at this point, it's wise to deny the invitation and just tell them that you don't feel comfortable. And so that's what I would highly recommend to you guys. Another thing is, what about wearing a face shield to protect eyes? Yeah, of course, you know, eye cover is important. You can put goggles on, you have glasses on, that's safe. And face shield is good, you know, whatever you feel safe, the more the better. It's not something that anybody will stop you from doing. So one question we would have is everyone here that's here today, are you guys all vaccinated? And if you're not, I highly encourage that you get vaccinated and get your family members that are not vaccinated, take them in, get them vaccinated. Even though it might be a little late for this peak, you're still much safer because there are going to be more peaks. It's not going anywhere till we are all vaccinated. And that's the only way to defeat this virus. The maximum number of people that's okay for gathering, you know, with CDC, and that's old data before this spike, was 49 people. But at this point, we are in the peak. And in the peak, there is no number that's safe. So at this point, for next 2 to 3 weeks, no number is safe. It's only your own family members. And even then, when they're going out, you have kids that are 18, 19, they're going out, meeting with other people, coming in, bringing that in with them. You don't know where they're going to catch it from. So at this point, if you are going to grocery stores, shopping, limit it to only essential visits only. So there's no amount at this point that's safe. when we are in the peak is, it's just like, it's just gonna multiply. Everybody, from 1 to 10 people are gonna get it and just gonna spread. So since breakthrough for vaccinated individual cases are low, why is it still important to vaccinated individuals to wear masks indoor? Very good question here. So if you looked at Massachusetts, what happened after July 4th was very alarming. So that's exactly why CDC went backwards and said, mask up everybody, vaccinated or not. Because in Massachusetts, after the July 4th event, 75% of vaccinated individuals came back positive for the COVID because they were not masked. So CDC went back, and that's last week that they said mask up, and that's because of that Massachusetts issue. Why now focus on unvaccinated? Absolutely focus on unvaccinated. There's no question that we don't need to focus on unvaccinated, but at the same time, unvaccinated is where you're getting the Delta variant. So at this point, you got exposed to somebody, you went to grocery shopping, you picked up, you touched something, you got the Delta variant. The vaccination is not as effective against Delta. It is still effective. It is still recommended to be done, but how it was 94 to 95% effective against the original COVID variant. And so at this point, that's why people are getting the breakthrough infections, because of the Delta variant. So you are still protected as compared to the unvaccinated, but how much protection you have against Delta variant is really what you don't want to find out, is what I'm saying. What CDC is trying to tell you is that after the Massachusetts event, everybody, you're vaccinated or not, mask up till we know where we're headed with this variant. So the other question, school starts in 2 weeks and planning in person fully at this time. So I'm concerned. Absolutely. I share that with you. I have a twin 7-year-old, and I share that with you that at this point, I think every parent is concerned starting in person, especially with the mask mandate is out and, there's not as many precautions, but the issue is there's no federal funding for the virtual program. So very, very few handful of schools are offering it. So, I mean, I think we'll see where the school heads by next week. Everybody's concerned about this peak. With Oklahoma, there's so many admissions, children admissions in the ICU. I think you're gonna see probably things change, hopefully so. And if not, then, every individual has to decide what they can do for their kids. How much viral transmission from preschool kids like age 4 to 5 years and older? I don't have the answer to that. I can go back and look at it, but I don't think we have much data on that either. Most of the transmission that we see is a little bit older age group, and then even admissions and stuff, we are seeing a little older than 5 years of age. But I can look that up, and Dr. Kamal, I can come back to you and let you know. I do want to say, if you do get COVID positivity, if anybody does get positive, look at the antibody infusion earlier, Regeneron, and every Baylor ER and stuff has it. And so all you have to do is call ahead, and if you're high risk, if you know that you have underlying risk factors, then you would qualify. They just give it to you and you go home after getting the infusion. For the treatment, if someone does get COVID, as I said, if you're earlier in the course, Regeneron is the way to go. You have to monitor your oxygen levels. If they're below 88%, that is the time to go into the hospital. Most ERs, especially Baylor ERs, Baylor Hospital, UT Southwestern, any closest big hospital is the way to go. Hopefully nobody will ever need ECMO, but that's another thing. If everything else fails, younger population needs ECMO, and not every hospital has it. So there are so many things. Maybe we can do another program on the treatment options that we have. Now we have, is it true if you have an autoimmune disease, the vaccine will not help? Heard a doctor mention that on CNN. Okay, so that's a good question too. The problem is not the autoimmune disease actually. So issue is, let's say somebody has lupus or rheumatoid, and so they are on immunosuppressive medications. They're either taking prednisone or they're taking chloroquine or they're hydroxychloroquine or they're taking other methotrexate, multiple options that are out there that suppress the immune system. So their immune system is not attacking their joints. So if the patient's on immunosuppressive because of the autoimmune disease, then if you give them the vaccine, their body may or may not make the antibody, right? Because the immune system is suppressed. So those are the individuals that, antibody, a lot of people ask, should we check the antibody level? And so again, CDC does not have clear guidance on it, but a lot of the individual physicians are checking their patients that are immunocompromised, their levels to make sure that they're mounting a response with the vaccine. And remember, you always hear, oh, somebody vaccinated got an infection. Nothing in life is 100%. So vaccine is not 100%. That's why it says 94% effective for Moderna, 95% effective for Pfizer, 66% effective for J&J. But all of them, all three of them are highly effective against preventing a severe disease. If you and I get just the drainage and sinuses and achy for a few days, we're all okay with it. What we're not okay with if you end up in the hospital on a ventilator. And that's what every vaccine, the goal is to prevent severe illness, where you don't end up on a ventilator, you don't end up with the pulmonary fibrosis, you don't end up with the prolonged problems. So I mean, I think the goals are should be very clear. You may still get the infection, but won't be as severe as if you were unvaccinated. So that's really where we have to focus on. The infusion name is Regeneron. I'll type it up in the, and that's what, if you know, President Trump got it in the past. It's called antibody cocktail. And that's outpatient. You don't have to be admitted or anything. You just call ER and they'll evaluate you, get you to fill out a form, and they'll tell them if you qualify for it, if you have an underlying condition that will qualify you. And underlying condition, you remember, if you're obese, if you're overweight, which majority of individuals are, if you're overweight, that is a risk factor. If you are diabetic, even if you're borderline, that's a risk factor. If you have other chronic illnesses, hypertension, coronary artery disease, all those are considered risk factors. You may think you're low risk because you don't know that you have high blood pressure, you don't know you have diabetes, you don't consider yourself obese, but you are high risk. If you fill out those forms, you'll see it, that what puts people at high risk. Sometimes we don't go to physicians and we don't know what's wrong with us. And just because we don't take medicine, we don't see somebody, that we feel we are healthy. Now, the other question, do you suggest everyone to get a thermometer and oximeter? So it is, the reason why oximeters were in shortage last time is because of that. Because you want to know if you, God forbid, if you do get COVID, then you want to know what your levels are with the oxygen, because that's really what kind of separates you from going into the hospital or staying home. And the levels below 88%, anything 88 or under is not good. That needs to be addressed, and this person needs to go to the hospital. If you guys have any other questions, you can type them up in the chat box.
What are the symptoms of the Delta virus? Any different?
Yeah, about 50% of the cases were atypical. Like they had just little dizziness or diarrhea or, like ringing in the ears. So that's another thing that we have seen is atypical symptoms as compared to the previous COVID, where we had typical cough and fever and all that. So if you have any of these symptoms, all of a sudden you're dizzy or you're having congestion and you are, hear ringing ears and stuff, you want to get tested still. I actually had a case just like that. She was immunocompromised, had lupus, and the only symptom she had was ringing in her ears. And ENT told her to take antibiotics, and so she for a few days she was suffering. It was actually a nurse in the hospital, and then I asked her to go get tested. She got tested. She was positive, and pretty severe actually. And she was vaccinated before, so that's why it's we don't want to know if you don't mask up, what will happen? And we don't want to push our luck because this is not something we have seen like this ever before. Flu killed people, but COVID has killed so many people and so fast that, at this point, the safest thing is to listen to your physicians and to believe science instead of believing these people that are putting out these hoax stories out there for people to just get confused. The other thing is, would a booster shot be a good thing now, or is it too much premature? Well, I think down the road, we're all going to see the booster shot. Everybody, we can't say anything at this point because we don't have CDC backing us up right now. But the data from Pfizer shows that the booster did cause very improvement in the antibody levels and did help our immunity. So I think booster is coming. We don't know when. Could you take Advil or Tylenol with COVID? That's another question. Yes, I mean, initially when originally when the COVID started back in March of 2020, people were saying, don't take Advil, don't take this. And that's not true. So Advil basically is a non-steroidal anti-inflammatory medication. So basically the goal when we treat COVID is to reduce inflammation. For example, we give a lot of steroids to reduce inflammation so it doesn't attack the lung. And so Advil is a non-steroidal anti-inflammatory, or Tylenol. So there's no contraindication. There's nothing stopping you from taking it. If you have fever, if you have symptoms, you can take them. So another question that I have here is, if you have autoimmune disease, but not on or immunosuppressive medications, what are the chances of mounting an antibody response? So for immunocompetent individuals, even if you have a autoimmune disease such as lupus or rheumatoid, the antibody response should be adequate. However, if you are in doubt, of course, you can always have your physician check those levels to make sure that you have adequate levels. But otherwise, if you're not on immunosuppressive, you should be okay. But again, there are some individuals that don't mount a response. And we know that even from previous vaccinations, even hepatitis vaccinations, that some people they get the vaccine and they don't make antibodies. And why that happens is more genetics and more, complex biologics. I mean, these are all excellent questions, I'll say. All right, guys, thank you for having me. If you have any other questions, please feel free to to ask. Otherwise, we will say Shab Khair for now, and then take care, stay safe, mask up. Anybody you know that's not vaccinated, give them information, get them vaccinated. If you want your mosques open, if you want to go out, you want to meet people, you know, you want to be safe for your family and for your society. At this point, we have to do this for our society. We have to do this to keep our ummah safe, our US safe, our community safe. We need this from every single individual to correct people that have misinformation and get vaccinated. All right. Allah Hafiz, everyone. Assalamu alaikum.